Now we will discuss today the embryological structures of the eye. Before going to the embryology of the eye, see the sagittal section of the eye. In this, you can have various tunics. The outermost one is the sclera and cornea, and middle coat, which is being shown in pink color, is the choroid. This is the ciliary body and the iris. Now you see the innermost lining, which is the retina. Okay. Now see the basic gastrulation stage, because these are the various layers which take part in the formation of finally development of the eye. See, this plate is the ectoderm. Now this ectoderm will give rise to this central plate structure called as neural plate. This is formed by the neuroectoderm. Okay. Now see that the edges of this plate shown in green color are the neural plate borders. Now this tube is going to be folded via a groove, and the edges or neurofolds are approximated. What happens finally? That this neural tube is being formed and detached here. And of course, the neural crest along with its neural cells are also being formed. And we can see a complete separate ectodermal layer on the top. Rest of the layers, which are mesoderm, are removed for the sake of simplicity. No endoderm is also being shown here. As we know that our eye start developing on 22nd day of the embryonic life, and these structures are taking origin from the four basic structures. You count them as neuroectoderm, the surface ectoderm, and the mesoderm in between these two, and the neural crest cells. Now see the neural tube, the prosencephalon area, and you can see the red single eye field. Now observe that this single eye field is due to the expression of PAX6 gene, paired box gene. There is a notochord and of course precaudal plate, and there is expression of SHH gene, the sonic hedgehog, that will convert the single eye field into two. Let's have another diagram for this. Now if you see, there is two eye fields now with the expression of PAX2 under the influence of SHH gene. Okay, now move towards the next picture. Here, the single eye field is shown to be converted into two eye fields, right? Okay, if the gene SHH is not working and we have got only the PAX6 gene which expresses as cyclopia, we could have single eye baby, cynophthalmia we label it, right? Now see, this is an embryo, and here we can see the sign of eye called as optic vesicle at the day 22 of the embryonic life. Now this lateral view of an embryo schematically being shown. This is the portion of the neural tube. This is the neural tube, and this one is the prosencephalon. This is the telencephalon, and this is the diencephalon. Here we have got this optical vesicle shown as a first indication of the eye development. Now, for simplicity, one portion is being removed. The ectoderm is no more there. We can see anteriorly or cephalic presentation of the neural tube, and you can see this is the area of the forebrain called as diencephalon, and laterally there is outpocketing of an optic groove or pit, and it forms the optic vesicle here. Okay, the optic vesicle is growing more, and the distal area is rounded, appearing as optic vesicle, and the most proximal portion is stalk-like, called as optic stalk. Okay, now you can see that the two lips of these optic vesicle and optic stalk, they are approximating each other but showing a gap in between, or we see that the invagination of these is not complete inferiorly. We get this a fissure called as optic fissure or choroidal fissure or retinal fissure. This fissure will not complete on the anterior aspect, and these edges will not approximate at the anterior aspect to form the pupil. And what do you see? You see that it provides an area for the passage of an artery called as hyaloid artery. Of course, along with the artery, the vein and the nerve fibers will also take the place here. Okay, now you can see that all this layer is completed, and we see the presence of hyaloid artery in the optic stalk, right? This edge will be showing the pupil here. Now remember that on the outer aspect of this we have got ectoderm, and the portion that is just anterior to it is the area of the ectoderm that is going to be showing the ridge called as lens placard under the induction influence of this optic vesicle. See, this optic vesicle has induced the ectoderm, and here we can see a lens placard. And this region is also in turn influencing the optic vesicle to form the optic cup. It means they are reciprocating the induction, and we called such induction as a reciprocal induction. See, now you can see the lens placard has become the lens vesicle and is trying to getting inside the optic cup. Now, another important thing before going to the detail, that the hyaloid artery is giving the vascular network around the lens vesicle. Now you can see the hyaloid artery is giving a network of blood vessels around the lens vesicle, and this is called as tunica vasculosa lentis, right? Now see what next. Okay, now you can see that proper cup-shaped structure of the optic vesicle is formed, having the outer layer and the inner layer, and in between we have got intraretinal space. Now see, this is the lens, and this area is the ectoderm, and we can see the passage of hyaloid artery that will regress, and just we will have central artery of a retina in the future. Now we should know that our eyes are initially laterally placed, but later on we have the medially located eyes. Now again see here, this is the neural tube. We have got the anterior pore and this caudally located posterior pore. During this development time, what we see that on its lateral walls, we have got the outpocketing called as optic sulcus, pit or groove on both sides. And here they are elongating to form the optic vesicle on both sides. And don't forget that there is all around the ectoderm, and the area just in front of this optic vesicle becomes the lens placard. Okay, what next? Now you can see here the optic cup has been formed and the lens pit formation is there. That pit will deepen towards the lumen of this cup and will convert into lens vesicle. And we can see that it will finally detach from the surface ectoderm. And what else we can see? In the choroid fissure, we see the passage of hyaloid vessel, right? Now here you can observe that this is again the sagittal section. The optic cup is showing its outer layer that becomes the outer pigmented layer of retina, and the inner layer of the optic cup will convert into the rest of the 9 layers of the retina, having the rods and cones, the bipolar neurons, and the ganglionic cell layers. So simply the optic cup is the future retina, outer layer becoming the pigmented layer and inner the neurosensory layer. Initially, there was in between intraretinal space that became obliterated. Now, what else we saw here? That the lens is being formed, and here the anterior cells are simple cuboidal, but the posterior cells are columnar, and they are growing as fibers to obliterate the cavity, and these layers fill up all around, and these layers are called as. In this picture, you have seen that the optic cup is transformed now into retina with its 2 layers. Okay, now another important thing in this picture, kindly concentrate that all around the eye structure, which is optic cup, is being shown by the presence of mesenchymal tissue, that is neural crest cell origin mesenchymal tissue all around. What do we see? That it is going to form what? It is forming the anterior chamber here due to the presence of a cavity inside. Now this mesenchyme will give rise to iridopupillary membrane in front of this region, this lens, and it is also contributing to the formation of layers of the cornea, the stromal layers, 2nd to 4th, right? And it is being said that the last layer of the cornea could be from the neuroectoderm. What else the mesenchyme is going to do? It also forms the inner vitreous humor, which was initially being formed by the lens and the retina. Okay, now what else we see? There in this picture, see there is a surface ectoderm that has developed into the eyelids. It is going to form the, if you can see here, these are the fused eyelids. Now you can see the conjunctiva could be there. So these structures are formed by the surface ectoderm. Okay, now we will move towards the next picture. This picture is just to show you that how the sclera and the cornea is present, and this is the iris. The iris and ciliary body, they are also formed by this optic cup, by the inner layer of the optic cup. And of course, the dilator and sphincter pupillae muscles are also being formed by them. And this is the canal of Slem for the absorption of the aqueous humor, which was being produced by the ciliary epithelium in the posterior chamber, and when it entered through pupil in this anterior chamber, that will be absorbed by the canal of Schlemm. Let me show you again that how iris and ciliary body they are produced. So concentrate that the optic cup has got the inner layer. The posterior 4/5 produces the 9 neurosensory portion or layer of the retina, and anteriorly giving rise to the ciliary body and the iris. So 9 layers basically makes the neurosensory layers, including in them the rods and cones, the bipolar neurons, and the ganglion cells are a part of it. Okay, now move again towards the other picture. Now this is the histological view in which you can clearly see that this is the optic cup, this is the outer pigmented layer, and this you see the inner neurosensory layer, and on the outer side the surface ectoderm has given rise to lens pit, and then it will finally become the lens vesicle. Okay, now again to make you remind that the optic cup has formed the retinal layers, the outer layer, the pigmented, and the inner neurosensory, right? Now you can see the additional thing here to make you remember that this mesenchyme has changed this loose connective tissue called mesenchyme into outer layer, the sclera, and the inner one, the choroid, right? And of course, over the optic stalk, they form the layers, outermost the dura mater, and inner one the pia and arachnoid mater. And finally, this optic stalk will convert itself into the optic nerve. And you can see the cornea is being formed not only by the contribution of the surface ectoderm, but also by this neural crest mesenchyme. Again, a similar picture to show that what is happening, all the neuroectodermal tissue in the form of the optic cup and the mesenchymal tissue taking part in the formation of sclera, choroid, and the dura mater, the pia, and the arachnoid and anterior. In this picture, now see how the lens plate grows. It has got the cuboidal epithelium, that thick ridge of the ectoderm, it converted into lens pit like this. Finally, this becomes deepened and is detached from the surface ectoderm to form the lens vesicle. Now see here that, let me enlarge the view. This lens is showing anteriorly the simple cuboidal epithelium and posteriorly the elongated cells in a form of a columnar shape. They are growing anteriorly to form the primary lens fibers obliterating this cavity. In this picture, you can well observe that this is now complete through primary lens fibers, right? Okay, now repeat all the topic which we learned so far, that this is the optic cup, and this optic cup has got the outer layer and the inner layer. The outer layer basically has converted into the pigment layer or 10th layer of the retina, and the inner 9 layers, they are forming the neural plate. And this 5th, now you can see that in this picture we can sum up that the optic cup has got 2 layers. The outer layer has converted into pigment layer of retina, and the inner layer is forming the neuronal part of the retina. And anteriorly, this inner layer is doing what? It is forming the ciliary body and the iris, along with the muscles inside the sphincter pupillae and the dilator pupillae. Now you can see that we have got mesenchyme, this pink colored structure all around, and this mesenchyme is neural crest cell origin. It is forming the sclera round on the outer side and the choroid right next to it. When you come anteriorly, what it does, it is taking part in the formation of anterior chamber. It forms the iridopupillary membrane and also contributes in the formation of stroma of the cornea, right? And this blue structure, blue lining, is ectoderm that takes part in the formation of eyelids, and they form the conjunctiva and its sac and the anterior stratified squamous epithelium of the cornea, right? Okay. There is another thing, that the mesenchyme, which is neural crest cell origin around the optic nerve, give rise to the dura mater on its outer side and pia and arachnoid on the inner aspect, right? Now see that this is the 2 layers of the optic vesicle, and we see in the choroid fissure the location of hyaloid artery, and then you can see the number of nerve fibers which are increasing by the time, and during 7th week and then in the 9th week the number has increased to the maximum level, and they are going to form the optic nerve finally. Okay, there are a few clinical applications. Here you can see that there is a cleft present in the iris. So such condition we called it coloboma iritis. And sometimes there would be the persistent of this network like iridopupillary membrane, and they may need surgical intervention later on. Now you can see a patient with aniridia, means there are no iris in both eyes, and probably due to the PAX6 gene mutation. Now you can see a picture with the cyclopia or synophthalmia, means there is a single eye field or fused eye field, and of course such newborns have got severe cranial abnormalities like hollow prosencephaly, and there is no nose as well. Okay, there is another picture of a patient showing the coloboma of the iris, right? And in this picture you may observe that there is no eye, the absence of the eye tissue called as anophthalmia, and even unilateral other features are not present. There is no nostrils as well. Now again and repeat the sign of ophthalmia with the fused eyes you can see, and rather there is a representation of the nose on the top region, right? Now you see that there could be a clouding of the cornea representing the congenital glaucoma. Okay, that could be due to some genetic defects or maybe due to trauma, infection, or some metabolic disorders. And here you can see that there would be the congenital cataract due to the rubella infection which the mother carries during her pregnancy. Okay, there is ptosis of the both eyelids, congenital bilateral ptosis. You can see the superior eyelids are drooping due to the failure of the development of the levator palpebrae superioris muscle that is supposed to cause the elevation of the eyelids, right? Okay, this is the basic picture. To sum up all the discussion we did so far about the embryology, you can see this green color tissue is the neural tube, which is formed by the neuroectoderm, and its diencephalon portion on both lateral sides gave rise to optic pit that converted into optic stalk and optic vesicle that later on formed the optic cup and the final optic nerve in the region of optic stalk. You can see that this optic cup is a future retina, and it has given rise to ciliary body and the pupil around the pupil, the iris containing the pupillary muscle, the sphincter pupillae and dilator pupillae. So this whole green shaded area is formed by the neuroectoderm. Okay, then you observe from the anterior aspect of this eye that this blue line is the surface ectoderm. This is taking part in the formation of eyelids, right? Formation of the conjunctiva, the epithelium of the cornea anteriorly, the first layer, right? So keep in mind that how the surface ectoderm is taking part in the formation of the eye structure. Then you can see this purple line, that is the neural crest cell mesenchyme that is forming the sclera, the choroid, and you can see that it is forming the stroma of the cornea and forming the iridopupillary membrane, the anterior chamber. And of course, we should know that this vitreous tumor is also being contributed by the mesenchyme. Initially, this vitreous body is formed by the lens and the retina. And don't forget that this lens was also formed by the surface ectoderm we discussed earlier. And above all, this whole orbit, the bony shell around it, is also formed by the neural crest cell mesenchyme, right? Okay, what left? The mesodermal mesenchyme that gave rise to extraocular muscles being inserted or attached on the sclera, and the lid musculature, which is levator palpebrae superioris and orbicularis oculi. So if you remember this chart, that will help you out that how the neuroectoderm in green and the neural crest cell mesenchyme in the purple, and the that here we have read so far, this green structure all around is neuroectoderm. The purple one is the neural cell crest cells mesenchyme, and then these brownish structure are the mesodermal mesenchyme, the extraocular muscles, and the lid muscles, the levator palpebrae superioris and the orbicularis oculi, and the blue color is the surface ectoderm. So remember this map and you will never forget the embryology of the eye. Thank you very much. Now you can see that this is just a plate called as ectoderm, and its center portion which is called as, now this is whole the surface ectoderm. This central portion is the neuroectoderm. See how it is going to be folded to form the neural plate. Now see, yes, the edges of the neural plate, they are approximated to form a neural plate. You can see, and on its lower edge you can observe the notochord. Let me show you. This is the notochord just below the neural tube. Now you can see this is a formed neural tube. It has got an upper end or cranial end and the caudal end with open neuropores, and in the center you observe the somites, right? And here is the place where the forebrain should be there, and we could be having the optic pits on the lateral wall of the forebrain or prosencephalon. Now we will learn with the help of the hand that how optic vesicle appears, and this is the optic stalk. Now you see that the surface ectoderm has come in front of it, or this portion will become thickened to form a lens vesicle. Now this optic vesicle will be forming a cup-shaped structure and the lens will be into it. Now see, this is the outer margin of the optic cup to form the pigmented layer, and this is the inner margins of this optic cup. So that's all for today.